After any procedure, especially plastic surgery, it is completely normal to feel a little unsure about what is happening with your body. You might find yourself constantly checking your incision, wondering, is this how it should look today? When you are recovering, the normal signs of incision healing include some mild redness, slight swelling, and a bit of itching or tightness around the wound site. These sensations and appearances are your body's amazing way of repairing itself. The why behind these changes is fascinating because your body goes through a carefully orchestrated series of steps to close and strengthen the surgical site. This process begins almost immediately with what is called the inflammatory phase. In this initial stage, your immune system springs into action, sending white blood cells to the area to clean it out and prevent infection. This is why you might see that mild redness, experience a little warmth, and feel some tenderness or swelling. It is a protective response, usually lasting for the first few days post-surgery. Following this, the proliferative phase kicks in. During this period, which can last for several weeks, your body works diligently to rebuild the tissue. Special cells called fibroblasts begin to lay down new collagen, which is a key protein that provides structure and strength to your skin. This is when you might notice the incision line starting to form a new, pinkish layer of skin. And it is also often when the itching sensation becomes more prominent as the new cells and nerve endings are developing. Finally, we have the remodeling phase, which is the longest stage, often continuing for many months or even over 1 year. Here, the collagen fibers reorganize and mature, making the scar stronger, flatter, and typically less red. The initial thick, firm feeling of the incision gradually softens as it blends more seamlessly with your surrounding skin. So, how can you keep track of these changes yourself? It is helpful to simply observe your incision daily. Look for a gradual decrease in redness and swelling over the first week or two. The color might shift from pink to a lighter shade. Pay attention to how it feels. The initial tenderness should subside, and the itching might come and go. A thin crust or scab forming is also a normal part of the healing process. Just remember, these are all signs that your body is actively working toward a full recovery. Understanding these detailed phases of healing is what empowers you to differentiate between a healthy recovery and something that might need your doctor's attention. For instance, knowing that the inflammatory phase involves a limited degree of redness and warmth helps you recognize that an increasing redness or heat could be a cause for concern. The fibroblasts, those wonderful cells, are constantly working to rebuild and refine the scar tissue, a complex dance of construction and refinement happening right beneath your skin. By recognizing these normal, predictable signs of incision healing, you can move through your recovery with greater confidence and peace of mind. Knowing what to expect allows you to trust your body's healing journey and helps you to quickly identify if something seems outside the normal progression, prompting you to reach out to your care team if needed. It is all about empowering you with knowledge for a smoother, less stressful recovery.